Good morning, everyone, and welcome. My name is Shireen Ash. I'm a librarian at the Corte Madera Library, and it's my pleasure today to have you join us for this program, Understanding Alzheimer's and Dementia. I'm going to ask everyone to stay mute during the presentation. We'll take questions in the chat. The presentation will pause at various times, and I'll read out your questions, and you can be assured that they will be answered. Plus, we'll have time at the end. So thank you again for staying mute. We're a big group, which is fabulous. So this way we'll all be able to participate and hear everything. So we are recording this presentation. You can go back and review it. It'll be up on the Marin County Free Library YouTube website. It usually takes up to 2 weeks, sometimes much quicker. But look there on the, you can just go to YouTube and type in Marin County Free Library and all our videos will come up. So I want to introduce you to our speaker today and our guests. So we are lucky to be joined by members of the Alzheimer's Association of Northern California and Northern Nevada. Sarah Holmson is a nurse and a family care specialist and volunteer family care specialist. She is the person I work with to coordinate these talks, and I'm really grateful for our collaboration. We're thrilled today to have star presenter Gene Giramonti. He is a volunteer community educator. He will take over and tell you all about understanding Alzheimer's and dementia. So I'm going to mute myself now, and Gene, the show is yours.
Thank you very much, Shireen, and thank you, Sarah, for being online. And welcome, everybody. I'm glad you're here to join us for this Alzheimer's Association educational program called Understanding Alzheimer's and Dementia. Again, my name is Gene Giramonti. I live in Santa Rosa, and I am a volunteer community educator. I have been for a couple of years now. With the Northern California and Northern Nevada chapter of the Alzheimer's Association. I work closely with the North Bay offices in San Rafael and Santa Rosa in particular. My connection to the Alzheimer's disease is that I was the primary caregiver for my late husband, Arthur, who was diagnosed in 2011 with both Alzheimer's dementia and vascular dementia. And he passed away in 2018, and that was a 7-year journey in which we were able to tap into the resources available through the Alzheimer's Association, and that included participation in support groups and taking advantage of their referrals to local or community-based resources and so forth. And we'll talk about that toward the end of the program today, about the resources available through this terrific association. So that's why I do what I do now, to give back some of my time to an association that was so helpful to us. So today's program is designed for those who are interested in learning more about Alzheimer's and other dementias. And we'll talk, we'll hear from dementia experts and perspectives from individuals who are living with the disease. Now, care partner is a term that many prefer to use over caregiver while the individual with Alzheimer's is in the early stage, and they may or may not need much assistance with daily tasks, and still benefit from the support of family and friends. So let's take a look at what our objectives are for today and what you're going to learn before we're done. Let me get to that slide. First, we'll compare the difference between the terms Alzheimer's and dementia. We'll talk about how the disease affects the brain. We'll learn about the risk factors that we all face. We'll identify the 3 stages, that is, of the disease. We'll get into a little bit about the FDA-approved medications that can address some symptoms of the disease. And we'll share with you what's going on in the area of scientific research. And finally, we'll talk about those resources and the benefits available through the Alzheimer's Association. Now, Alzheimer's is a global crisis, and you likely are hearing more and more about it in your personal lives and on the news. So we're going to start off here by do a little test of your knowledge to see what you already know about the impact of Alzheimer's in the United States. So if you're comfortable, go ahead and just enter your true false. Well, this is not the true false one, excuse me, but if you want to enter your answer into the chat box, and then Shireen will help me read out some of the answers. But how many Americans do you think are currently living with Alzheimer's disease? You've got 4 choices there. So I'll give you a few seconds to enter what you think is the correct answer.
$5.8 million is leading. 12, oops, got some 12 millions.
Okay, well, we've got some alert folks there. 5.8 million is the correct answer. Barring any developments in prevention or treatment methods, this number is projected to reach 14 million by the year 2050. And currently, an estimated 50 million people worldwide are living with dementia. So are you ready for another question? Again, we'll let you enter your answer here. How many unpaid, I gotta move my box here so I can read my own notes. How many unpaid Alzheimer's caregivers are there in the United States? You might get a little hint by the former answer of 5.8 million people living with the disease. This is a pretty big issue in terms of the number of people it does take to care for those of us living with the disease.
Looks like it's a toss-up in our response. Oh no, 8.5 is coming to the lead.
Okay. Well, that's only about half correct. There's actually 16.2 million Americans that are providing unpaid, that's unpaid care for people with Alzheimer's or another dementia. Now, Alzheimer's impacts caregivers both at home and at work. More than 80% of care provided at home is delivered by family members, friends, or other unpaid caregivers. And over half of employed caregivers, meaning unpaid caregivers who are also employed, report having to go into work late, take time off, or quit altogether due to caregiver demands. Now, I can attest to the truth of that last statement because Art had retired before me, and when he was diagnosed, he was already retired. I was still working a pretty demanding job, commuting back and forth to work, making my days pretty long. And as time went on, as his disease progressed, the stress that I experienced both at work and at home became almost unbearable to the point where I did actually retire 2 years earlier than I would have normally, because the cost of paying for a caregiver at home versus my stress level and all those things just got to the point where I said, no, I will do it myself. I'll stay home and be the primary caregiver. And you can only do that for so long as well. But anyway, that's just a personal example of how things can be quite challenging if you're working and caring for someone. It becomes like a 24-hour day. And these unpaid caregivers provided approximately 18.4 billion hours of care last year, valued at more than $232 billion. Meaning if you had to pay someone to do, a professional from an agency and so forth to do those caregiving tasks, it would be worth that kind of money. So as you can see, this disease takes a personal impact on the individuals facing it as well as a financial one. So let's learn a little bit more about the impact of Alzheimer's disease. So you may hear the terms Alzheimer's and dementia used interchangeably. They are related, but they're different. In this section, we're going to discuss both Alzheimer's and dementia and how they're related. But before we begin, we're going to take a moment to test your knowledge one more time about Alzheimer's disease. And this is a true or false question. I'll let you enter your answers. The statement is Alzheimer's is a normal part of the aging process. True or false?
Overwhelmingly false.
As I said, we have a very alert audience. That is correct. Alzheimer's disease is more than memory loss. It's a progressive and fatal disease that kills nerve cells and tissue in the brain, affecting an individual's ability to remember, to think, plan, and ultimately function. Let's try one more. People younger than age 65 can develop Alzheimer's. Is that true or false?
True.
Good answer. Approximately 200,000 Americans younger than age 65 are living with younger onset Alzheimer's, which is also referred to as early onset Alzheimer's. And in some cases, people develop the disease even in their 40s and 50s. So we're going to watch a video now of one of our experts, Dr. Heather Snyder, who will explain how Alzheimer's and dementia are related.
Dementia is the umbrella term for an individual's changes in memory, thinking, or reasoning. There are many possible causes of dementia, and Alzheimer's is the most common cause. Other causes of dementia are vascular dementia, which is marked by changes in the blood flow and the blood vessels in the brain. Dementia with Lewy bodies, identified by specific brain changes throughout the brain that include the buildup of a protein known as alpha-synuclein. And frontal temporal dementia, which is marked by brain cell loss in the front sections of the brain or the frontal lobe. Each type of dementia may have distinct characteristics to cause specific behaviors in the individual, but there is also some overlap in behaviors among the types of dementia.
So as we saw, there are many causes of dementia other than Alzheimer's. However, about 60 to 80% of all dementia cases are caused by Alzheimer's disease. I'm going to open this glossary of dementias here so you can get an idea of how many different diseases do fit under that umbrella of dementia. I won't go into each of these. If you have questions at the end of the program, I can come back to this slide and we can open it up. For example, if you just want to look at dementia with Lewy bodies, it will give a lot of information here about what that looks like. But for now, I'm going to move forward, and we're going to hear from a care partner who she's a care partner for someone who is living with dementia with Lewy bodies. And she's going to talk about the importance of a diagnosis, of an accurate diagnosis.
Certainly having the diagnosis of Lewy body was helpful in our planning because we began to understand where this was coming from in the brain, where otherwise we would not have known. Like we knew something was happening, but what was it? To give it a label actually helped, although it was a big umbrella. It explains some of the characteristics and symptoms that we were experiencing and seeing.
So while there is not yet a treatment that can slow or stop Alzheimer's, There is great value in seeking an accurate diagnosis so that you know what you are facing and better understand what to expect, and also to rule out any other causes of symptoms that have been noticed, because sometimes other conditions can appear like symptoms of dementia, but be something different. So just to recap here, what we've learned to this point, dementia is a general term for a collection of symptoms that are severe enough to interfere with daily life. Alzheimer's being the most common cause of dementia, and it is not a normal part of aging. It is a progressive brain disease. So before we move on to the next topic of inside the brain, what it looks like, if there are any questions that have come up in the chat box, Shireen, if there's anything that we can answer at this point, otherwise we'll continue.
So, Jean, there haven't been any questions yet.
Okay.
So it looks like we can go on.
Okay, great. And again, we'll have time toward the end. So as discussed, Alzheimer's is a brain disease. The brain is our most complex organ. It's also our most powerful, despite weighing only about 3 pounds. So we're going to hear from one of our experts now about how Alzheimer's affects the brain.
More than 100 years ago, Dr. Alice Alzheimer's described specific changes in the brain, what we call the formation of plaques and tangles. Now, Alzheimer's is a progressive brain disease that's marked by these key changes and is thought to impact memory, thinking, and behavior. The brain has 3 main parts: the cerebrum, the cerebellum, and the brainstem. Each one plays a role in how the body functions. The cerebrum fills up most of your skull. It is part of the brain most involved in remembering, problem solving, thinking, and even feelings. There are about 100 billion nerve cells or neurons throughout the brain that transmit messages in order for us to create memories, feelings, and thoughts. Alzheimer's disease causes nerve cells to die, which leads to the brain tissue loss, or what we call shrinkage, and causes loss of function and communication between cells. These changes can cause the symptoms of Alzheimer's disease, such as memory loss, problems with thinking, planning, behavioral issues, and even at the end stages, problems with swallowing.
So just to quickly recap here, more than 100 years ago, Dr. Alois Alzheimer described specific changes in the brain, the formation of these plaques and tangles. And Alzheimer's causes nerve cells to die, which leads to shrinkage in the brain. The brain, and these changes in the brain result in effects on memory, thinking, and behavior. So again, it's not just about memory. Okay, in this next section, we're going to talk about risk factors that we face. Everyone with a brain is at risk of developing Alzheimer's disease. There are a few known factors that increase a person's risk of developing Alzheimer's disease. Again, we're going to test your knowledge. Let's see if you know which one is the most common. So which of these options do you think is the greatest risk factor for Alzheimer's disease? Is it genetics, family history, or age?
Without counting exactly, it looks like a pretty even split between the 3.
Well, that's actually okay because, well, age is the greatest known risk factor. All 3 are risk factors. But again, age being the greatest known risk factor. Now, that doesn't mean that everybody over a certain age is going to develop Alzheimer's. If that were true, then everybody would have the disease over a certain age. But what it does mean is that the existence or the presentation of symptoms are most common, or at least age is the greatest factor involved in that. But family history in terms of socioeconomic factors, health issues, lifestyle situations, that can also affect brain health, and clearly genetics, how we're hardwired, can also be a factor. So all three are correct. It's just that age is the greatest known. So let's hear from one of our experts as she explains the most common risk factors.
Alzheimer's disease is marked by specific brain changes that result in the clinical changes in individual experiences. That is, changes in memory, thinking, or reasoning. And ultimately, Alzheimer's is fatal. The exact cause for these changes is unknown, but there are some hints as to what may contribute to an individual's risk. Age is the greatest known risk factor for Alzheimer's, and when we look at populations of people, we see an increased risk over the age of 65. However, Alzheimer's is not normal aging. Family history is also a known risk factor. Research has shown that those who have a parent or a sibling with Alzheimer's are more likely to develop the disease, and that risk increases if more than one family member has Alzheimer's. When we talk about the genes involved in Alzheimer's, there are two categories that could potentially be involved: risk genes and deterministic genes. Risk genes increases an individual's risk for developing the disease, but does not guarantee that they will develop Alzheimer's. Deterministic genes, which are rare for Alzheimer's, guarantee that the person will develop the disease.
So in addition to the main risk factors for the general population, Hispanics, African Americans, and women are at higher risk for Alzheimer's. Now, research shows that older Hispanics are about 1.5 times as likely as older whites to develop Alzheimer's and other dementias, while older African Americans are about twice as likely to develop the disease as older whites. The reason for these differences is not well understood, but researchers believe that higher rates of vascular disease in these groups may also put them at greater risk for developing Alzheimer's. Just interject here, we also present a program called Healthy Living for Brain and Body. And in that program, there's a lot of research shared about just our basic understanding of healthy lifestyles, meaning good heart health, exercise, diet, social engagement, cognitive activity, all of those things that improve our cardiovascular health may also be having a positive effect on our brain health. So that's what this point is making here on this slide, that in some populations where diet and exercise and other factors may be at play on the cardiovascular system, that could have an impact on brain health as well. Women are more likely than men to develop the disease. An estimated 3.4 million American women are living with the disease today. We know that women live longer than men, making them more likely to develop Alzheimer's. However, longevity and lower death rates can only partially explain this difference. Researchers are exploring how genetic differences between men and women may impact disease risk. So to summarize this section here, Alzheimer's disease involves the failure of nerve cells, the exact cause of which is still uncertain. I think I skipped ahead. No, I didn't. I'm sorry. Research has identified risk factors that increase the likelihood of developing Alzheimer's. Age is the greatest known risk factor for Alzheimer's, with individuals' risk for developing the disease increasing at age 65. Family history is a known risk factor. Having a parent or sibling with the disease increases an individual's risk. There are two types of genes associated with Alzheimer's: the risk genes and the deterministic genes. Hispanics, African Americans and women are at an increased risk for developing Alzheimer's. Our next section is we're going to talk about the stages of Alzheimer's disease. But if there are any questions pending in chat, I'll take a little break here for those.
There aren't any questions. However, if someone has a question for anything Jean's discussed at up to this point, it would be great to pop it in, but there haven't been any questions up to this point, Jean.
Okay, thank you, Shireen.
Sure thing.
So no two individuals experience the symptoms and progression of Alzheimer's disease in the same way. We're going to hear from another expert, Dr. James Hendricks, on why this is the case, as well as from some individuals describing what it's like to live in the early stage of the Alzheimer's disease.
One of the things that impacts our brain is all the other things that can happen to us as we age. And we know that Alzheimer's, the most common risk factor for getting Alzheimer's disease is age. But we also have lots of other things that go wrong with us as we age. And so how those other health factors impact our brain can also impact how Alzheimer's presents in other people.
It's a different kind of forgetting. It really, really is. It's not just forgetting where I put my car keys. It's much deeper than that. And for example, I cannot read a book. I used to be a voracious reader because by the time I turn a page, I have forgotten what I had read. And if you're reading a novel, you have to know what transpired before in order for you to continue to read on. And so I can't read a novel, so I've even stopped trying.
You know, the example that she just gave is one that was one of my first indications that Art was having some difficulties, because in his retirement, he was a voracious reader. He always had 2 or 3 books on his table, and I would see the bookmarks steadily moving. And we had gone to a book signing event down in San Rafael, where he was excited to read a book about JFK and got the author to sign it. And when I noticed the bookmark stopped, he started the bookmark stopped moving. I asked him a few questions about it. And at one point he said, I can't remember the page I just read. I keep turning the pages backward, and I finally gave up. And that was really a clue, or not even a clue. It was a direct indication that he was having some difficulty. Neither of us understood it at the time. So that's not an uncommon thing. Let's hear from some others living with early stage.
Math, I can't do a simple tip anymore. You know, I sit there, I stare at it. It's crazy what numbers I can't deal with anymore. And in some ways, that's the disease to me. The other thing that I've increasingly been struggling with are words, which I've dealt with words my entire life, you know, as an avid reader, as a reporter, as a writer. I struggle with them now.
I'm like an overachiever and when you're unable to deliver or you're not performing at the same pace that you once did before, that's frustrating. It's frustrating to not know where you place things. It's frustrating to not be able to explain to someone the problems that you're having. You can't articulate it in a way. It's frustrating to read something and you forgot what you read. It's frustrating to continuously have to change your password and you just changed it last week and you're constantly doing the same thing over and over again.
I think the thing that surprises me the most about my dementia is that it is progressive. And I'm finding that I'm forgetting more. And they do memory tests for me all the time at the doctor. And so that becomes a little disconcerting at times, to see my cognitive impairment continue to decline. But again, I really have hope. I don't live really in the future. I can't live in the future. I can't worry about what the future is going to bring. I have to live for today.
You know, he said something there that I think is true of most people in the early stage of the disease, which is a high level of self-awareness of what is happening to them. So their frustrations can be significant because of that self-knowledge and ability to understand that they have deficits, but they can't do anything about it. And he mentioned there that he gets tested periodically, and that is a standardized cognitive abilities test that he's referring to. And when someone goes through the diagnostic process, they normally and should get that test administered by a qualified, experienced, usually a psychologist is the ones who administer that test. And I remember after Art took his second follow-up, he had one test to establish the baseline. And there's a series of questions that are asked. Some are quite simple, like what city are you in? Who is the president? What's the day of the week? You might have to do a few simple drawings, like draw the face of a clock with a certain time on it. And then in Art's first follow-up test, about 6 months later, it was clear that he had declined from the first test. He answered fewer correct questions and so forth. And I remember very distinctly when we left the doctor's office, he looked at me and said, "I really did badly, didn't I?" And that was hard for me to hear, because he knew that his decline was increasing at that point, and it was just a hard thing to accept. But that's so. Anyway, I'll get back to the program here. But the individuals we just heard from are living in the early stage of the disease, and symptoms do worsen over time for everyone. However, people progress through the stages of Alzheimer's at different rates as their abilities change. Now, on average, a person with Alzheimer's lives 4 to 8 years after diagnosis, but can live as long as 20 years, depending on other factors. We're going to hear again from Dr. Snyder, who will explain the 3 general stages of Alzheimer's disease.
Alzheimer's affects everyone differently. As a result, it's difficult to place a person in a specific stage of the disease. However, there are 3 general stages that are commonly referred to as early, middle, and late stage Alzheimer's. In a medical context, you may hear these stages referred to as mild, moderate, and severe. In the early stage of Alzheimer's, an individual may be able to function independently. However, they may start noticing more frequent memory lapses. Friends and family may also begin to notice difficulties in the person, and a healthcare provider may be able to detect problems in memory or concentration by conducting a detailed medical interview. Middle stage Alzheimer's is typically the longest stage and can last for many years. Damage to the brain cells can make it difficult to express thoughts and perform routine tasks, and this can lead to increased feelings of frustration and anger. In the final stage of the disease, an individual loses the ability to hold a conversation, control their movements, or respond to the environment around them. Cognitive skills, that is, their memory, thinking, and reasoning skills, continue to decline, and this can lead to personality changes and need for round-the-clock care.
So as mentioned, it's important to remember that the stages of Alzheimer's are general. And because each person living with the disease has a unique experience, we can't always neatly place an individual into one specific stage. In fact, some people may exhibit symptoms that overlap stages. However, the stages do allow you to gain a general understanding of the progression of the disease. As Alzheimer's progresses, the individual's behaviors will change, as does the role of a caregiver. These stages can help caregivers prepare for what to expect and understand how best to respond. Just a quick recap here. The 3 stages are early, middle, and late, and are sometimes referred to as mild, moderate, and severe in terms of a medical context. No 2 individuals experience the symptoms and progression of Alzheimer's in the same way. And while symptoms worsen over time, people progress through stages at different rates as their abilities change. In this section, we'll talk about the FDA-approved treatments for symptoms. And we're going to start this section by seeing what you already know about treatments available for Alzheimer's. So again, you get to take a pop quiz here. It's a true or false statement. There are several drugs available to slow down the progression of Alzheimer's disease.
It looks like most of the responses are false.
We have a very bright audience today. That is correct. So there are several drugs available to slow down the progression. This is false. There are currently no treatment to prevent, treat, or slow Alzheimer's disease. But there are several drugs available to address some symptoms. So there's a difference there. Treating the symptoms, the effect of the disease versus the underlying cause. So we're going to hear from Dr. Hendricks about these medications.
There are currently several drugs that are FDA approved to treat the cognitive symptoms associated with Alzheimer's disease. They treat the symptoms, but they don't treat the underlying cause. So eventually people will progress, but they do treat some of the symptoms and help people for a time. So the first class of drugs are cholinesterase inhibitors. These drugs work to prevent the breakdown of acetylcholine, which is a chemical messenger found in the brain that's associated with learning and memory. There are 3 FDA-approved drugs that are in this class of drugs. There's Aricept, there's Exelon, and there's Razidine. There's another class of drugs that modulates glutamate, which is another chemical messenger in the brain that's associated with learning and memory. And this drug is called Namenda. And then there's a final class, which is actually a combination of cholinesterase inhibitors and glutamate modulator, and this is called Namzaric.
So let me just add some new information to this slide. I was unable to upload the updated slide here. I apologize for that, but I'm sure many of you have heard about the recent approval from the FDA for an Alzheimer's treatment medication called aducanumab, or the brand name is called Aduhelm. The difference between this new approved drug and these 3 that you see on the slide is that there is evidence that aducanumab actually may slow the progression of the plaques and tangles in the brain. In other words, it may offer more time for an individual living with the disease if in fact this drug is going to slow down the progression. But there's some controversy, obviously, over this because of its cost and method of delivery. It has to be done by infusion rather than in pill form, as these 3. And there was also some discussion about whether or not the FDA rushed the approval or not. But the Alzheimer's Association was involved in, as they are in all areas of research and clinical trials. We'll hear a little more about that in a minute. But the Alzheimer's Association does stand behind the effectiveness of this drug, and now it's a matter of getting insurance coverage to cover it, and to do the FDA has agreed to do some additional ongoing research to learn even more about it. So that's what I can say about that development. And if you have other questions, we can take those at the end. And I may want to refer you to folks in the association with more expertise than I have on that matter. At any rate, as Dr. Hendricks said, these treatments can help relieve some symptoms in people for a time. I know that my late husband did take both Aricept and Namenda. First, he started with Aricept and then added Namenda. It was not clear to me whether or not they were helping. And so I discussed with the doctor whether or not we could stop it for a time and see if I could compare the difference, which we did. And I did notice that they probably were helping to a degree. But again, it's different for everybody. And again, it's not going to stop or slow down. These drugs anyway will not stop or slow down the progression of the disease. And an accurate diagnosis is really important to ensure that the proper treatment is prescribed, and drug misuse could lead to negative side effects. So are there any questions on medications before I move forward?
Yeah, actually, I wanted to get to a question that came in before you got deep into this section. So, and that question is there any research that has proven particular lifestyle changes would make any difference in Alzheimer's?
That's a great question. And the answer is yes. In fact, a lot of the research is being focused on lifestyle factors. There's a major study that was done in Finland, which has now been picked up, especially in this country and others around the world, to show that what I mentioned earlier about proper nutrition and diet and exercise in particular are key, because they're showing some linkage between cardiovascular health and brain health, and that the better brain health we have, the more resilient the brain seems to be in working around possible compromises to the brain when a disease becomes present. So diet, exercise, cognitive activity, in other words, keeping ourselves cognitively active with challenging things, not just watching TV, but maybe watching TV on a subject that challenges your level of knowledge on a subject. And then socialization too. The more we're socialized, the more we're active with other human beings, seems to show an increase in brain health. And so those research studies are still ongoing, but there is some positive evidence that lifestyle changes have an impact, a positive impact. And that sounds obvious, but now research is actually linking those things.
Thank you. That's just exactly the question, is looking at that linkage and quantifying it with research. So perfect. There's been a little bit of back and forth about MMS. It's not FDA approved, and there's some potential dangerous side effects. I don't know if either of you want to address that at all, or if you have any knowledge about that substance.
I'm not familiar with MMS. Sarah, I don't know if that's something you have understand.
I'm also not familiar with it. I just, for anyone seeking alternative treatment, suggest that you work with your physician to make sure that it does not counteract with any prescribed or other over-the-counter medications that you're taking. And then one other thing about alternative treatments that aren't FDA approved and have those really strong, robust research numbers involved is some of these treatments can be extremely costly. Like I said, I don't know what MMS is, so maybe it's not one of them, but I just always encourage you to use your best judgment and to work with your pharmacist and or doctor.
Well, that's really solid advice. Thank you. There is a question here. As a caregiver who's helped people with this disease, it's really talking about quitting alcohol and how to help someone who has alcohol, either alcoholism or struggles with alcohol intake, realize they need help, since they may become more stubborn once they're further into further along in their Alzheimer's or dementia progression. And again, I don't know if that's something, Jean, that you can address.
Well, you sort of answered your own question in the sense that alcohol does have a negative effect on the brain if used in excess or to a degree that is unhealthy. So removing that element and that added insult to the brain would certainly be helpful for someone who has been diagnosed. Again, that's something that if someone's going through the diagnostic process, it would be important for the physician or the medical providers to understand a person's daily habit, or smoking also is a compromise to the brain because it compromises cardiovascular health. And so if there's a way to convince the person that that's a lifestyle change that they need to make, I think it would have a positive impact. And there is some research to show that a lifetime of excessive alcohol use does in fact compromise brain cells.
Thank you. And then it looks like the last question for this section is, do either of you have an opinion on Dr. Dale Bresden's book from the Buck Center on Aging? And it's called The End of Alzheimer's, the First Program to Prevent and Reverse Cognitive Decline. Is that book familiar to either of you?
Again, I've heard of it, but I've not read it. So that's probably one to add to my reading list. I'm sorry, I can't address that.
Sorry, I was trying to start my video there. I am familiar with it, and Dr. Bredesen is kind of along the same line of my answer for MMS. So his study was not done on a large number of participants. So it's really not proven that his theories work. I do know a number of people who have followed his practice. Some thought that they saw some change, and others said that they didn't. His program is quite costly. It focuses on supplements and diet. So if you wanted to talk to your doctor about it, I would suggest that. But sort of like my answer about the cost versus, the risk versus the cost of it. I've spoken with more than one family who's kind of spent their life savings doing his protocol and saw no change. So in that case, that's heartbreaking. I guess that's probably all I'll say. Thank you.
Thank you.
Thank you, Sarah.
Yeah, thanks, Sarah. So we do, I jumped the gun, sorry. We have another really great question about developing new habits. So a family caregiver is struggling to convince their family member to wear absorbent underwear and kind of to accept that incontinence is becoming an issue. They hate making them unhappy, but don't want this person to suffer being embarrassed. So if you have any thoughts or advice on that, that would be welcome.
Yeah, that's a pretty important concern, and I know that I struggled with that as well with Art when he became incontinent with urinary function. I didn't have much trouble, convincing him, but I think there are secondary medical issues that can result, from incontinence. If someone's, underwear isn't changed frequently enough, can develop infections, urinary tract infections, and so forth. So if you can help the person understand that it's in their best overall health interest, many people, even people without Alzheimer's disease, develop incontinence. So it's not an uncommon human condition. It's an inconvenience, but there are ways to make a person comfortable and help them be confident that, they won't have unfortunate accidents and so forth. It is a difficult, in my support group, I participated in for several years, actually, which was tremendously helpful. But one thing that was hard to hear was that incontinence can be the single greatest factor that causes caregivers to kind of just really feel inadequate and stressed out and have a hard time. And it's often one of the things that caregivers will make a decision to actually find a facility to let the person be cared for in a more controlled circumstance. So it's a major concern with those who have incontinence. Sometimes having a medical professional or a third person engaged in the conversation. But yeah, people feel embarrassed about it. So that's probably some of what's going on there.
This person adds that he can be combative about wearing them, and he forgets that we've had the conversation multiple times.
Can I say
Yeah,
one thing, Jean?
Sure.
In the interest of time, since it's so specific, I'm the family care specialist in our office. I would be more than happy to talk to whoever's asking this question or specific questions, maybe about their loved one or their situation, in a one-on-one. So I will add my contact information in the chat, my phone number and email, and maybe we can touch base out of this meeting. Because I know this could be a longer conversation. So I just didn't want you to have to go into too much detail, although I know you've probably got a lot of wonderful advice, Jean. So
Thanks, Sarah.
Thanks for that, Sarah. Yeah, and when we get to the end here shortly, we'll have a slide that provides you with the 1-800 number for the Alzheimer's helpline, Alzheimer's Association helpline, which is staffed with professionals. So I'll talk about that in a little more detail here in a few minutes, because that can be an excellent resource for any question you have that I may not be able to answer. Okay, I'm going to move on to our research section here, Advancing Alzheimer's Research. Now, in the last decade, researchers have made enormous strides in understanding how Alzheimer's affects the brain. Many recent insights point toward promising new strategies for treatment, prevention, and diagnosis. So we're going to hear what Drs. Snyder and Hartley, and then two care partners have to discuss about hope for the future.
This is an incredibly exciting time in Alzheimer's and dementia research. The advancements that we've made in the last decade to understand the disease as a continuum, meaning that the biological changes are starting a decade or more before someone is experiencing the changes in the memory and thinking. This sets the stage for possible prevention. The idea that when we have the tools to identify those individuals at the earliest time point, and when we have the interventions to target individuals at that earliest time point, we can intervene to stop or slow the progression of the disease before an individual loses their memories.
Dr. Hartley.
I'm excited about what we're learning these days regarding lifestyle. One of those things that we've seen in the past of things like exercise and nutrition have now started to gain more momentum to indicate to us that it can change your ability to slow cognitive decline. That is really the first stages of Alzheimer's disease. This may include things like social engagement, mental cognitive training. It can be things such as exercise. It can be nutrition. All those things are now starting to point that they will lower your risk for Alzheimer's disease.
And let's listen to a care partner.
A lot of hope does come from the Alzheimer's Association, all the research that is being done. even though there is not a cure today for the disease, I know in my heart there is going to be a cure one day. And I know we're getting closer for that cure. Because even if you fail in a research study, you learn from that failure in the research study. That failure always brings progression.
It's nice to see the association spearheading in many ways the emphasis on getting the money at the federal level and at the private sector to get the research done so that someday there will be an effective treatment, hopefully cure, hopefully prevention.
So as we've just heard, there is a lot of hope for where we're headed with Alzheimer's research. One of the key ways to keep research moving in the right direction is through clinical studies. Scientists are looking for new ways to treat Alzheimer's, and there are many drugs currently in the research pipeline. Recruiting and retaining trial participants is now the greatest obstacle, other than funding, to developing the next generation of Alzheimer's treatments. So we're going to hear from some experts about the importance of these clinical studies for the future of Alzheimer's treatment.
More important than ever for people to participate in clinical studies. The fact is, right now, we don't have an effective treatment to stop Alzheimer's disease. And if we don't have people participating in clinical trials, we never will. And so participating in a clinical study is one way that everyone can get involved in a very direct way in the fight against Alzheimer's disease. And for people who currently have dementia or Alzheimer's disease, there are some additional benefits. You get access to very close medical care. You also may be among the first people to have access to the treatments that will eventually prove to work.
Sometimes you hear the phrase, it's a failed trial. That means that it didn't hit the endpoint, it didn't achieve an FDA-approved drug. But I would say as a scientist, the only failed trial is one that doesn't give you valuable information. And if the trial is well designed, if it is a good scientific experiment, you get extremely valuable data so that you can plan the next trial and do the next study even better than the last one. And it gets you that much closer to that FDA-approved drug, to that effective treatment, and maybe someday even a cure.
As we heard from Dr. Fargo, everyone can help to advance Alzheimer's research. It's especially critical that people of diverse backgrounds participate in clinical research. Because they are at an increased risk of developing the disease, it's important that researchers are able to study large populations of these individuals to better understand the disease and their elevated vulnerability. Let's take a look at an association service that can help people find studies.
Currently, more than 5 million Americans are living with Alzheimer's. By participating in clinical research, you can move us toward methods of treatment and prevention for all those affected by this devastating disease. Alzheimer's Association Trial Match is a free clinical studies matching service for those with dementia, caregivers, and healthy volunteers. To start, simply create a confidential user profile and receive a list of studies that may be a match for you. Don't just hope for a cure, help us find one.
So let's take a look at what we just discussed. Scientists have increased their understanding of Alzheimer's significantly over the past decade. People with the disease, caregivers, and healthy individuals without dementia are needed to participate in clinical studies in order to find methods of prevention, treatment, and ultimately a cure. This recent drug I mentioned that was approved couldn't have come about without large populations of people entering these trials. Both drug and non-drug studies are taking place across the country and online. Clinical studies may provide participants with cutting-edge treatment and additional medical care. And Trial Match, through the association, is a free clinical studies matching service for people interested in participating in such research. Alzheimer's is difficult, but no one has to face the disease alone. So now let's learn a little more about what the Alzheimer's Association offers in terms of support and help to individuals and families across the country. The Alzheimer's Association is in communities across the country, providing direct service to individuals and families facing the disease. And Sarah just gave a great example of how she's ready to have a discussion with someone participating here about their concerns. So that's what we do. The mission of the Alzheimer's Association is to eliminate the disease through the advancement of research, to provide and enhance care and support for all affected, and to reduce the risk of dementia through the promotion of brain health. Our vision is a world without Alzheimer's disease and all other dementia. So, the association is available wherever and whenever you need reliable information and support. And this slide shows 3 of our key resources that can connect you to information and support. And they include what I mentioned earlier, our 24/7 helpline, 800-272-3900, anytime, day or night, to receive information and support. This is not a typical call center by any means. It's staffed with highly trained and knowledgeable experts who can help with education, decision-making support, crisis assistance, and resource identification. Again, master's level clinicians are available around the clock to provide in-depth care consultation, which is a free of charge care navigation service offered to families at any stage of the disease. Again, you don't have to try this on your own. There are established protocols and suggestions that will fit your situation. And help is available in more than 200 languages. So we're going to hear first from Tim, who is a care partner who has called the helpline for support.
I've had a couple of phone calls that I've been able to make in to the call center when I've had a couple of quick questions that I wanted to ask. You know, there's been a couple of nights, 2 o'clock in the morning, you have questions, you have anxieties, and I was struggling dealing with them, and it's amazing. It was one of the best things I ever did was keeping the call center on my favorites now. Just to know that there's somebody you can call who is aware of what you're going through.
I completely identify with Tim and what he just said, because that number has been in my favorites on my phone for many years now. And like he said, there were times in the middle of the night when I would wake up with tremendous amount of anxiety about what the next day was going to be like. When you're caring for someone, as some of you I'm sure have witnessed yourself, but when you're caring for someone with Alzheimer's disease, especially as it progresses, each day is different, and things that you thought you knew change. So having this number available to you and having these kind of experts available to empathize, to understand, and to offer you the kind of help that will really make a difference. So we're all very thankful for this resource. Next is the website, alz.org. And this is often the first step or first stop for individuals following a diagnosis of Alzheimer's or another dementia. And it includes sections specifically for people living with the disease and caregivers. It's a very robust website with a lot of good information, especially if you're interested in what is going on in the research world. So we're going to hear from Teresa again, who's living with Alzheimer's, about the questions that she had and the information she found on the website.
When I went to the Alzheimer's Association website, which is alz.org, Then I was trying to find out more about what was Alzheimer's, what really is this disease, what is younger onset Alzheimer's, what is dementia, is there a cure, how long has this been around, how many people are affected by this, where can I go for resources, where can I go for help, what do I do with this? How can I handle this? Is there more people like me out there? Is there someone that I can talk to if I need to? And there I found the support line that's 24 hours a day. And there I found where I can go for workshops, where I can go and read things and postings that people have done, where I can find out what events is happening in the Alzheimer's Association, where I can see how it's affecting people around the globe.
And the last key resource on this slide is the Community Resource Finder. This is a wealth of community-based resources available in your area, including long-term care and community-based services, local association offices and their offerings of programs and support services. And you can go to the website /CRF to access this information. Again, this was tremendously helpful to me in terms of finding transportation services, day centers where Art could go for a half a day at a time and have a meal and so forth, which gave me some respite time, which is really critical for caregivers. But let's listen to Tom here, who used this particular resource.
Since I've been diagnosed with dementia, the one place that I know I can go to for assistance and help and support is to the Alzheimer's Association. There are people there that I know by name that I can contact if I'm having a difficult time or if I'm struggling to find some resource, that they will provide that to me.
So now that we've taken a basic look at Alzheimer's disease and what resources are available, let's talk briefly about how you can take action if you're inclined to do so. So there are ways to do that with the association. I chose to do the volunteer activity that I'm doing. That's one area where you can be of some useful help. And whether it's just a few hours a week or more of a significant time commitment, there's just many ways that you can participate in this area. Advocacy is a major pillar of what the Alzheimer's Association does for all of us, and that is to advocate for those facing this disease and their caregivers, to speak out on behalf of this population, to gain greater public policy changes that will make a difference, to get greater funding for research and so forth. So this is a very robust part of what the association does at the local, at the state, and at the federal level. And if you're someone who's interested in periodically joining a team of people to go to Sacramento or to your local legislative offices to have a chat with those who represent us, this is the way you can do that. We talked about the trial match. Again, we need as many people as possible to enter clinical trials. And if you go to the website, as was mentioned in one of the previous video clips, you can enter your profile and get information about what studies might be of interest to you or might be relevant to your interest. And then the Walk to End Alzheimer's, the walk in the North Bay is coming up on October 9th, and it will be held at Sonoma State University in Rohnert Park. And this is the single largest, let's see if I get this right. It's the world's largest fundraiser for Alzheimer's care, support, and research. And this is a fun event. We get lots of people participating. Last year, because of the pandemic, of course, took on a different flavor, but this year we're going to be getting back to a more normal walk activity. And these go on across the country at different times of the year. So if you're interested in that, you can go to the website and maybe get on a team. So with that, the program is concluded, and I thank you for your excellent listening to the program, and I will now open it up. You see the number there on this screen. Please jot that down if you have any desire or need to call that 800 number. So I'll stop talking at this point and open it up. Shireen, if we have some questions.
At this point, we don't have any questions that have gone unanswered, but I do want to point out Sarah has been very busy putting lots of really helpful information in the chat. So I just encourage everyone to scroll through the chat. You'll find links to research. There's a copy of the slides that Sarah posted early on, the helpline, which is on screen, also in the chat, information about trial match links. So just a lot of great resources. So just take a minute before the program ends. So please do that. And also I popped in a link to a list of nonfiction books at the libraries in Marin that are available to check out. So that might be of interest to some folks, and a reminder that this seminar is being recorded and will be available on the Marin County Free Library YouTube website within 2 weeks. So we've gotten some lovely thanks, wonderful seminar. Sarah also posted a link asking for experience about today's program. So you can record a short video testimonial by following the link. So that might be something of interest. A lot of thank yous.
Shireen, let me just add too, you mentioned the books. I didn't type it in because I'm not good at multitasking here, but for those of you who enjoy movies, there are 2 movies within the last year that deal with different elements of facing the Alzheimer's disease. They're not documentaries. You may have heard of one of them, at least, called The Father with Anthony Hopkins. It's a very well-made movie, which gives you the sense of perspective from the person that is experiencing the disease. It can be a little confusing at first until you realize that the director of the movie has tried to present the film in a way that Anthony Hopkins, the lead character, would see his environment. In fact, he did win the award for Best Actor in that movie last year. And then the other movie is with Stanley Tucci and Colin Firth, who go on a road trip in England, but the topic is that one of the characters portrayed has early onset Alzheimer's, and that's all I'm going to say about it. It's a very moving movie. It's uplifting. It's not just a sad and tragic type of story, but both highly recommended, at least from my perspective. The movie with Colin Firth and Stanley Tucci is called Supernova. The title has nothing to do with Alzheimer's. It has to do with one of the characters portrayed is interested in the stars and the astrological world. So excellent movies.
Thanks, Jane. It looks like we have some questions to catch up on. What was the best support group you found?
Well, it was directly with the Alzheimer's Association. And of course, once things calm down with COVID, we'll be able to get back to in-person support groups. So both my husband and I were in support groups at the same time, but in separate groups. He was with the group of folks that had the disease. I was in the spouse group, care partner group. And we met once a week for about an hour and a half each time, and tremendously helpful, because unless you're living in that sort of situation, it's hard to really grasp all that's involved. And being able to discuss with people who have the same experience was just a huge, it's just that, it's a support. So that's the only one that I participated in. Just parenthetically, I did, when my stress level got to a point where it was going to break me, I did seek some counseling for a while, with a clinical therapist. And that also was helpful in my just being able to deal with how I was coping with the pressure and the stress of the situation. And so those things in combination were hugely helpful to me in getting through that journey.
Thank you. Another question, are there adult daycare programs in Marin that would provide activities for people with mild Alzheimer's?
Yes, and the one that we used was called and I don't know if they've changed their name, it's in Novato, it's called the Marin Adult Day Health Center. One of the advantages of that particular organization is that they do have physical therapists and a nurse on hand for if you have someone you're caring for that needs a little additional attention, like Art did, because he ended up in a wheelchair and had some weakness and issues of falling and so forth. So they were able to actually give him some physical therapy while he was there. But they do all kinds of activities. They served a meal. There's another organization in Marin County, and I'll turn this to Sarah too, because that's where the association keeps these resources available. But the other one in Marin County used to be called Senior Access, and I believe they've changed their name the last time I went to look them up, and I can't remember what that is. But they are for people especially that have no mobility issues. They do excursions, little like field trips to go to various places of interest. And they also have a physical location where people can go to do projects and socialize and so forth. I know there are probably others that I'm not familiar with, but those are the two I'm most familiar with.
You got it, Jean. There are two in Marin. Lifelong Marin Adult Day Health in Novato, like Jean mentioned, and then Senior Access is now called Skyview Day Club. So I did put the websites for both of them in the chat. I will tell you that because of COVID, both of their doors are closed right now for in-person programming. But Skyview Day Club is offering a free program Monday through Friday, 10 a.m. to noon via Zoom. That's actually quite engaging. I joined one day to see what it was like and found it to be really good. So on the website, on the link that I put in the chat, you can see information about how to sign up if you're interested. Fingers crossed, sometime soon they'll be able to reopen in person.
Thanks.
There are resources in San Francisco too, and that's where using the 800 number might be a good place to get information for other areas that you might be interested in, especially if you have family members or friends in different parts of the country. I know a good friend of mine, his cousin has been diagnosed with Alzheimer's. So I put my friend in touch. She lives in New York. I put him in touch with the Alzheimer's office closest to her, and they've gotten connected now. So to me, that's a success story.
That's a really good point. There's a question about light therapy. Do either of you know anything about this?
I don't. I know there's something called sundowner syndrome where at the end of the day, people that do have dementia tend to decline a little more, get more fatigued and a little more confused. But I don't know if light therapy is something that is in conjunction with that.
I'm not familiar with it. I have a feeling that it probably falls in line with kind of alternative treatments for the disease. In that case, I'd say feel free to reach out to me directly, but if it's kind of what I'm thinking, I'd just say it has not been FDA proven. I'm sorry, that's my phone. To work, but if it is something that your budget can afford, I know a lot of people are interested in alternative treatments, but feel free to call the 800 number to learn a little bit more, or feel free to reach out to me and we can talk about it one-on-one.
So there's a comment from everyone, from a listener rather, to everyone in the group, that it's just the recommendation that it's good not to overwhelm a person who has dementia with more than one subject at once, to remain calm when talking to them, look at them in the eyes, nod yes. So to be very responsive and direct and calm is sort of what I'm getting. I don't know if you want to add anything to that.
That's all good advice. And in fact, on Thursday, I'll be delivering a program called Effective Communication Strategies, which is directed primarily to caregivers in working with their person on communication, because we have to slow down, as you say, one subject at a time, keep things very simple. You will find you do have to repeat yourself, and that's just part of the disease. Is that short-term memory is seriously affected. So you might tell someone something, and 15 minutes later they won't remember it. It's not because of their willfulness; it's because they can't. So that's a good program. If Shireen, if you ever are interested in presenting that one too. So. Yes, there's a lot of good tips for how to work as a caregiver, how to deal with the person.
I would be very interested in working with you both to offer that program. It sounds very, very helpful. So let's talk about that. Thank
Sure.
you. That was great.
Mm-hmm.
So we're getting some nice thank yous. Thank you for a very informative presentation. It was excellent, and I learned a lot. So that was the whole point. So that's terrific.
Thank you.
Can I say one more thing just before we end? I know we're getting close to time.
Absolutely.
Sometimes I feel like putting so much in the chat can be a little bit overwhelming to kind of go back and look through. But if anyone on this call today is a family caregiver and you would like some more information or education or training, a few times a year we offer what is called a Savvy Caregiver class. It's a little more intensive. It's 2 hours a week for 6 weeks. We're holding it on Zoom, and we have 2 classes coming up, one that starts in September and one in October, but it's for family caregivers, so not paid professionals, but it's a really good foundation for this journey and this process. And please feel free to reach out to me, email, phone number, or you could even call our 800 number and they will connect you with me if you live in the North Bay. And we still have a few spots open if you'd be interested, and we could talk about it further. So
thanks for mentioning that, Sarah. It sounds like a great opportunity. I've also put my email in the chat, which is sash@marincounty.org. And I'm just going to ask Sarah to send me a lot of the links and the links to the slides. So you'll have 2 points of contact. Of course, I would go to Sarah first, but if you need a backup, I'm happy to help provide content. And again, this is being recorded and will be up on our YouTube website in a couple of weeks. So can these resources in chat be put in the YouTube video? So no, they can't. Just the slides themselves and Jean's lecture. But again, please reach out to Sarah or myself, and we're happy to provide you with these resources.
you can also, and I learned this only recently, if you want to save the chat, at the very bottom of the chat box, you'll see a little icon. One looks like a piece of paper with the corner folded in. Next to it's a happy face. If you click on the one that looks like a piece of paper with the upper right corner folded in, and then you click, you can save it in a number of formats. So the bottom one is your computer. You could save the chat that way if you wanted to refer back to it. Or like Shireen said, you can always kind of reach out and say, oh, you mentioned support groups. Can you send me that link again, or whatever it is?
Hey, thank you for that tip. I never knew that. Thank you, Sarah.
There's always more to learn.
Yeah. That's good for the brain, though. Learning new things keeps it going.
Absolutely. Thank you, Shireen and Jean. Thank you both so much. I really appreciate your time and efforts and helping to make this happen today.
You're most welcome. It's always a pleasure to work with you both, and it's great content for our community. So I'm really appreciative. And Thank you, Jean, for
Terrific.
the presentation. It was very clear and lots of great content. Thank you.
Thank you. Thanks everyone for attending. I'm hoping you learned a lot.
So with that, we're at about 10:30. So, and we aren't getting any more questions. Some people have already signed off. So I will say thank you once more. Have a great day, everyone. And I'll end the meeting. All right. Bye, everyone.
Bye, everyone. Thank you.